I'd like to review the normal echo views and hand movements needed to perform a 2D transthoracic exam. As you'll see, there are many imaging windows for which you use to perform a 2D echo exam. We will first focus on the parasternal images. These images will be located left of the sternum, in between the third to fifth or sixth intercostal spaces. The first imaging plane is the parasternal long axis, and we'll be slicing the heart anteriorly to posteriorly, as seen in the graphic here. Your indicator will be facing the patient's right shoulder. The transducer position is about 11 o'clock, 10 to 11 o'clock, facing the patient's right shoulder, and once again, looking anterior to posterior. In this view, looking anterior to posterior, your first structure you'll see will be the right ventricle, the interventricular septum, left ventricle, posterior wall, mitral valve, anterior leaflet, posterior leaflet, left atrium, left ventricular outflow tract, aortic valve, right coronary cusp, non-coronary cusp, ascending aorta. The next imaging view from the parasternal long axis will be the right ventricular inflow tract view. This view, once again, will be slicing from the parasternal long axis imaging. Your indicator will remain in the same position, facing towards the patient's right shoulder. And during this movement, you will take the transducer, the back end of the transducer will be tipped towards the patient's left shoulder. You'll be slicing the heart in a more anterior axis, imaging the two anterior chambers, the right ventricle and right atrium, with the tricuspid valve in the middle. And here's the movements you'll see over here. You'll start from a parasternal long axis and tip it towards the patient's left shoulder. So once again, tipping it towards the patient's left shoulder. Indicator towards patient's right shoulder. The next view from the parasternal long axis will be the right ventricular outflow tract view. So this will be just the opposite motion of the inflow tract. So once again, you'll keep your indicator towards the patient's right shoulder, and instead of tipping it towards the patient's left shoulder, this movement is just going to be the opposite. You're going to take the tail end of the transducer, or the back end, and tip it down towards the patient's right hip. So as you see in the image here, from the parasternal long, you're going to tip downward towards the patient's right hip. That's the motion right there. And what you'll see is the right ventricular outflow tract, pulmonic valve, main pulmonary artery. The next set of pictures is going to be called the parasternal short axis slices. So the short axis slices can obviously be many images. As you see here, there's 6 different levels that you can image. We will focus on the level of the aortic valve first, then level of the mitral valve, then left ventricular papillary muscle level. To obtain these images, what you're going to do is take your transducer and your indicator, instead of being towards the patient's right shoulder, you're going to rotate 90 degrees towards the patient's left shoulder. You're still going to take the transducer and angle it into the body, anterior to posterior. So as you slice, we're going to do what we call as a sweep, a sweeping motion. So first, as you'll see the hand motions here, this is the motion from a parasternal long axis. Once again, you'll see this is going to be angling towards the patient's right shoulder, and you're going to rotate the transducer towards the patient's left shoulder. So once again, parasternal long, parasternal short, parasternal long, parasternal short. And as you angle the first sweep, as you angle a little bit um, towards the upper level of the heart, you will cross the aortic valve level. And in the aortic valve level, you will see the right ventricular outflow tract, pulmonic valve, main pulmonary artery, tricuspid valve, right atrium, intraatrial septum, left atrium, aortic valve in the center, non-coronary cusp, right coronary cusp, left coronary cusp. So the next view you'll see is the sweeping is in the level of the 3 and 4, which is the valvular level or the mitral valve level. And once again, your indicator will be towards the patient's left shoulder. And here's a demonstration of the sweep. So angling this way, back in the transducer downward, will give you the aortic valve cut. Dead center or anterior to posterior will be mitral valve cuts. Now as you angle upward or down towards the left ventricle, there'll be the cuts of the left ventricle. So once again, you'll see mitral valve level, aortic valve level, mitral valve level, and then left ventricular level. In this view, you'll see the right ventricle, interventricular septum, left ventricle with the mitral valve in the center, with the anterior and posterior leaflets seen. The next level, you'll see the slices here towards number 5. This will be sliced left ventricle, and once again, your indicator is going to be in the exact same position, and you're going to be doing this sweeping motion. So once again, starting from the top, this will be the aortic valve level, mitral seen dead center, and then angling down towards the apex, you'll see the left ventricle. In this image, this will be the right ventricle, the interventricular septum, left ventricle, postural medial papillary muscle, and anterolateral papillary muscles. So once again, you'll see there's no rotation being done during this sweep. You're sweeping from the aortic valve to the mitral valve down towards the left ventricle. So no rotation, just a sweeping or angling back and forth through the many slices of the heart. These are all called the short axis slices. Like a loaf of bread, you're slicing the bread in individual cuts. The next set of views are going to be taken from the apex of the left ventricle, and the transducer position is going to be right here. And as you'll be seen in the demonstrations to follow, you're going to be angling up towards that patient's right shoulder. This is the angle of incident you want to perform for the apical views. So the first view is the apical 4-chamber view, and your indicator is going to be down towards the patient's armpit. And if you look at the time of the clock, it's going to be between 3 and 4 o'clock. And once again, the slice angle is going to be from the apex of the left ventricle all the way towards the patient's right shoulder. In this view, you'll have the apex under your transducer imaging plane. You'll have the left ventricle, the apex, right ventricle, right atrium, left atrium, anterior mitral valve leaflet, posterior mitral valve leaflet, tricuspid valve, interventricular septum, and interatrial septum. Descending aorta is seen here. Nice view of the right upper pulmonary vein. And in this view, you like to line up your transducer so your interventricular and interatrial septum is parallel to the middle of your beam axis. And you want to make sure your right ventricle is inserting lower than the left ventricular apex so you do not foreshorten your image. The next imaging plane we'll look at is the apical 5-chamber view. Now this view is basically a slight modification of the 4-chamber view. And once again, your transducer position is going to be identical to your 4-chamber view with, once again, your transducer indicator towards 3 to 5 o'clock and towards the patient's armpit, and you're still going to be angling towards the right shoulder. But the only difference right now is you're going to take this transducer, you're going to tip the transducer down maybe 5 or 10 degrees. So right here, apical 4-chamber, slight tilt down. So it's a little bit of an anterior tilt, back end down, looking more anterior, and that's a 5-chamber. So 4-chamber, 5-chamber, 4-chamber, 5-chamber, a slight tipping of the transducer. And what happens is in this view, you will get the left ventricular outflow tract and the aorta in your picture. So once again, left ventricle, right atrium, left atrium, mitral, now left ventricular outflow tract and aortic valve, and a portion of the ascending aorta is seen. This is a great view to obviously do color flow and pulse and continuous wave Doppler of the aortic valve. Now the next view, basically you're taking the transducer and you're going to counterclockwise 90 degrees. So once again, your angle of incidence is going to be towards the patient's right shoulder. You're going to take the transducer and counterclock a half a turn, so the transducer will be up now to this position here. So as you see this position here, this is a 4-chamber. A half a turn is a 2-chamber. Now if you look over here in the 2-chamber view, you'll see basically the left ventricle and the left atrium in your picture. And once again, this is going to be the inferior wall of the left ventricle, the anterior wall of the left ventricle, anterior mitral valve leaflet, posterior mitral valve leaflet, and the left atrium. So once again, when we image this patient, you're going to keep exactly the same axis. You're going to basically go from the 4-chamber view, half a turn, to the 2-chamber view. The next image is going to be the apical long axis picture. And this basically, you're going to have the same orientation. Transducer position is going to be angling up towards the patient's right shoulder, but now you're going to go basically from the 4-chamber, you're going to go 180 degrees to the 3-chamber view. So once again, you're going to take another half a turn, another 90-degree angle back to the apical 3-chamber or apical long axis picture. So if you see, this is a 4-chamber, this is a 2-chamber, another half a turn is a 3-chamber. Back to a 2-chamber, back to a 4-chamber. So once again, rotating a half a turn backwards, another half a turn again, that's the 3-chamber. So in the apical 3-chamber view, which very much mirrors the same imaging plane as the parasternal long axis, you're going to see the left ventricle, mitral valve, left atrium, left ventricular outflow tract, interventricular septum, a portion of the right ventricular outflow tract, aortic valve, descending aorta, anterior leaf of the mitral valve, posterior leaf of the mitral valve. The next picture we'll be taking is from the subcostal window, and basically it's going to be just below the subxiphoid process and between the ribs, and we're going to be angling our transducer towards in between the patient's sternum and left shoulder where the heart's present right here. You're going to angle your transducer towards that angle, and your indicator is going to be at 3 o'clock. When you angle this image, we're going to get a nice slice of the heart from the subcostal position, yielding us a 4-chamber image of the heart. And what you'll see, the transducer obviously is going to be closest to the right ventricle, so you're going to have right ventricle, right atrium, left atrium, left ventricle, mitral valve, tricuspid valve, interventricular septum, interatrial septum. This is a very valuable view to look for pericardial effusions. Also a very good view to assess both the intraatrial and interventricular septums for any congenital abnormalities such as a ventricular septal defect or an intraatrial septal defect or a patent foramen ovale, because you're perpendicular to the structure, and if you apply color to this, you can see flow going across, so you'd be parallel to flow. So this is a nice subcostal window and a view that's often used to assess function and effusions. The next view from the subcostal position will be looking at the inferior vena cava. So this is called a subcostal 4-chamber with IVC. And basically, you're going to take your transducer, your indicator that was at 3 o'clock is going to basically rotate over, and you're going to now, instead of looking towards between the person's sternum and the left shoulder where the heart is, you're going to actually rotate the back end of the transducer. You're going to angle it towards the patient's right shoulder, but you're going to counterclock your transducer probably about 5 to 10 degrees. And that's going to basically visualize or focus on the inferior vena cava coming up. So the hand movements right here, you're going to counterclock and rotate. So you'll see again, 4-chamber, slightly rotate and tip it up. So we'll show this again. Rotate over towards the right. Once again, rotate over and tip the transducer a little bit. Your right atrium will be here. This will be your liver. You'll get a very, very nice long axis of the inferior vena cava. This is very important to us. When we look at the inferior vena cava, we want to look at the size of the IVC and how much the IVC collapses with respiration. Typical values for IVC is less than 2.2 centimeters, and we expect upon inspiration that the inferior vena cava should collapse usually greater than 50% of its size. This indicates a normal right atrial pressure, so it's very helpful when we use hemodynamics for assessing pressures on the right side and also calculating pulmonary pressures. The last view that we use is called a suprasternal notch view. And once again, this view is going to be placed in the suprasternal notch region, which is basically above the sternum in between the clavicles, right in this area right here. And the important thing to do here when you place the transducer is the focus is to angle down into the body and visualize the heart. And what we're going to be able to see in our images is a portion of the ascending aorta, transverse, and the descending aorta. So here's the slice from the transducer position is going to be basically positioned about 1 o'clock on the patient. So just over the person's left shoulder at 1 o'clock. And once again, the transducer should be angling down into the body. Important to be down, the angle down the transducer. You need to tip this transducer upward and look down into the body. So obviously you want to have the person flex their head backwards. And once again you'll see is a portion of the ascending aorta, transverse, and descending aorta. And you'll have a cross section of the right pulmonary artery here. This is the brachiocephalic, left common carotid, and left subclavian. The 3 branch vessels coming off, as you see, 1, 2, 3. This image is important to look for ascending aortic and transverse arch for aneurysms, also looking at the descending aorta for any potential coarctation of the aorta. Also, if there's any potential dissections, as an aortic dissection present in the aorta. Once again, very important angle down. Some patients have difficulty flexing their head back. You can lift the patient up and actually put a pillow behind their shoulders and have their neck flex a little bit more so you can get into that suprasternal notch um, window space. Obviously, some patients in the ICU and CICU have the inability to flex the head, so you try to do the best you can to get what you can for the imaging planes.